Thank you so much, Dr. Jeff Hatcher, for joining us today on a very important topic of Ebola virus. So first of all, what is this Ebola virus and why should people care about it and why should they learn more about it?
So Ebola was discovered in 1976. There are 5 strains, 4 of which infect humans, and one of which was actually discovered in Virginia in a monkey trading facility.
Virginia, America?
Mm-hmm.
Oh.
It was the subject of the book, The Hot Zone.
Oh, okay.
So the most important thing we need to know about Ebola, or what's so scary about it right now, is the very high mortality rate that's associated with it. It's somewhere between 50 and 90%, and right now the current epidemic mortality rate is around 70%.
Wow, yeah, so pretty fatal condition. Mm-hmm. And how did it come into the picture? Where is this virus usually found, and how did it end up becoming this epidemic that it is right now?
So traditionally, Ebola was found in very rural communities. Historically, we haven't really known where it's come from. It's thought to be associated with fruit bats in Africa, and because the nature of society in Africa has changed and become more urbanized, then what used to be an epidemic of very small rural communities has now entered into large population centers.
Oh, okay. So, so fruit bats are the ones which are primarily usually the host, and right. Now because of the expansion of the human population interfering with the jungles or those areas that it has entered our system. So, right. How do the humans usually get the infection?
I think that's been somewhat of a mystery in the past. I think currently there's some speculation that it's associated with bushmeat. And that exposure to either fruit bats or to people who eat bushmeat, that they could be exposed to the virus through that.
Okay, so that's how the humans have gotten the infection. And what happens when somebody gets infected?
Well, there's a brief incubation period, or a variable incubation period, that can be anywhere from 2 to 21 days. It's typically on average around 8 to 10 days. It typically starts with a high fever, and then what you would expect to be seen in a typical viral infection, sort of flu-like syndrome, muscle aches, joint aches, sore throat, and then progressively worsening diarrhea and hemorrhagic diarrhea even.
Blood in the diarrhea. So would you say if a patient, suppose somebody who has traveled to the affected zone like Liberia, mm-hmm. has come to the United States, or now he's somewhere else, and for 21 days since he left the country, he's not symptomatic, so we'll assume that he does not have virus likely?
That is what we would most likely assume. There have been some outliers up to 23 days.
Up to 23 days.
Currently the recommendation is if you're within the 3-week period and you don't have symptoms, you're assumed to be non-infectious.
So up to 3 weeks from the time of exposure to up to 3 weeks, if no symptoms, then you are not infectious, right. Or not infected. Not infected. So let's talk about infectivity. Suppose you are infected, then I'm assuming as soon as the virus hits you, are you infectious from that time itself? And if so, then how long the infectivity lasts?
All right. So if you assume that you were infected on day 0, that's when you came in contact with the virus, people aren't thought to be infectious until they develop symptoms. So when people have a fever, we assume that they're infectious from that point forward. Or if they develop any other this sort of flu-like syndrome that's associated with it, then we would assume them to be infectious.
Okay. And the infectivity can last, once they're infected, it can last again up to 21 days, or?
At least 21 days. We assume that as long as someone is symptomatic, that they're infectious. Studies have shown, however, that the virus can be found in some body fluids for up to 3 months afterwards. In particular, it's been found in semen for up to 3 months after an infection. Okay,
so that's why I think they're recommending to follow abstinence mm-hmm. for up to 3 months.
Yes.
To reduce the risk of transmission. And infectivity means the potential that somebody who is infected with the virus is symptomatic, how long they can spread the infection. What are the main symptoms of Ebola virus?
Well, it's mostly high fever.
High fever.
And then other sort of
vague symptoms.
Vague symptoms that are associated with viral syndromes.
Okay.
Muscle aches, sore throat, headache, diarrhea,
myalgia.
Things like that.
Mm-hmm. And suppose we have a patient who has come from affected zone in North Carolina, and I'm seeing that patient with non-specific symptoms, and I suspect just because he's coming from affected area, how do I go from there further? How do I diagnose?
Right. So currently, our understanding of how to diagnose people is based mostly on epidemiology, where they're from, and what kind of exposures they may have had when they were in that area. From that forward, you're working with what their symptoms are. So if they're from a high-risk area, they've had a high-risk exposure, and then they have symptoms that are consistent, then you have a probable case or a high-risk case. From that point, you'd be needing to contact your infection prevention staff at your hospital, as well as your county health department, and then they would be in touch with the state health department and in touch with the CDC.
In touch with the CDC. And we do have some serological tests that we can order, or are they readily available in every hospital?
There are serologic tests and PCR that are available, but it's done through the state and through the CDC.
So you need to report to the CDC.
Yes.
And then they will dispatch the necessary test.
The blood from your patient will be sent to them.
To the CDC. Oh, I got it now. Okay.
That's part of the difficulty in handling this, is that the body fluids are so infectious. The recommendations are to have point-of-care labs only, and that way you don't contaminate your whole main lab.
Oh, that's why. Okay. That's very good information to have. So now, this just a general question, because it's so infectious and it's so fatal, should the smaller hospitals be transferring those patients to specific hospitals? How should they proceed? Like somebody in the community where it's a 100-bed hospital and...
So currently the recommendation from the CDC is for hospitals that have the staff and the capacity to handle the patients should be trying to handle them there. As you could see from the patients who were in Dallas and who were in Atlanta, transporting these patients is a huge undertaking. So it's best to try to keep the patients at this point in centers or in local centers where they can be cared for.
Okay, that's very, very important information, I think, to our providers, medical providers out there. And with that comes the question, how to keep them safe, the medical providers or the family members or visitors. What is the current CDC recommendation?
So right now it is double gloving, gowns, an N95 mask, and eye protection. And the patients are being kept in strict isolation, which means they have an anteroom, and then they have their own room. They have dedicated nursing staff who don't care for any other patients. So that's part of the difficulty in dedicating staff and the tremendous amount of work that goes into it, as well as the risk that's taken on by healthcare providers.
Right, and N95 mask is the very, very special mask, right? It's like the ones we use for patients with tuberculosis. So basically airborne precautions.
Right.
It's a part of.
Yeah. So that's the sort of the paradox of taking care of these patients, is that Ebola isn't spread by an airborne route, but there is such concern about aerosolization of body fluids that we're using.
Like coughing and sneezing. Yeah. Okay. So better to be safe. So that's why their CDC has upgraded to N95 mask. So, and how is the human-to-human transmission usually happens? How is that patient going to infect somebody else? For example, my question is, how do we trace the contacts that patient or person has and say, oh, you could have got Ebola, so you need to be evaluated as well?
Right. So anyone now with a close contact with a patient who's infected would be considered someone who should be monitored, which currently the standard for monitoring is doing twice a day temperature checks and symptom checks. The outbreak in Africa is driven by not only the close care that's given to patients by their family members, but also by the very intimate burial procedures that the patients undergo. In the United States and in healthcare workers in Africa, the risk is mostly associated with the high volume of fluid that the patients are putting out. It's, from the conference that I just went to from the Infectious Disease Society, the patients were reported to be putting out between 6 and 10 liters of fluid a day, which is a huge amount of fluid to try to be handling in a single room with only one nurse.
Yes, absolutely. Okay, so and what type of the contacts we are talking about will be close contacts? The one who have been exposed while the patient is having nausea, vomiting, or diarrhea, or anybody who has even spoken to the patient?
It's probably more likely anybody who's been in contact with their secretions. Those are the people who are at the highest risk.
Now that the patient, suppose this patient who has come from affected area, the physician suspected for him to have Ebola, has notified CDC and the blood work is sent and they're assuming it's Ebola infection, what is the treatment modality? And the patient is kept in very good isolation. What to do next?
So what we've learned from the people in the Emory and the Atlanta CDC experience was that because of the tremendous amount of fluid shifts that the patients have every day, they're very susceptible to metabolic derangements and electrolyte derangements, huge shifts in potassium, huge shifts in calcium, and so monitoring those things is extremely important. Mostly it's managing volume and managing fluid. Certainly the patients are at risk for developing coagulopathies, so giving people blood and platelets as they need it is extremely important. But it's really just very advanced supportive care is the best way to describe it.
Advanced supportive care. So watching them, because we don't have, I'm assuming we don't have specific treatment even now, although there were some drugs that were given to the patients in Emory. However, the drugs that the patient in Dallas got, it didn't work. Was it the same drug?
I believe what's been the mainstay of treatment so far has been trying to use monoclonal antibodies. There have been some attempts to use convalescent serum from patients who have recovered, but there is not a huge amount of convalescent serum for us to get our hands on right now, so that's not a huge source of therapy for us.
So basically just the supportive care, see what the virus could be affecting and try to keep fixing what is destroyed.
Right.
Basically, that's the cheese beer. And if I ask you what people can do in order not to contract Ebola, would be don't go near the patient who even you think may have Ebola.
That's probably the best advice. Certainly, no one wants to start a panic and escalate what are already very real fears in some communities. Certainly the risk of the average person in the United States is incredibly minuscule low, and it's just really a matter of, for us as healthcare providers, for people who are government officials or working in airports, it's really a matter of doing good triage and doing good source control and doing some good epidemiologic shoe leather work.
Right, as I say, don't be scared of Ebola, just learn about Ebola.
Right.
Is that correct? All right, and do you think we can contain this epidemic?
I think we will contain this epidemic. It's going to take some time. Currently, the most recent statistics out of the CDC, even as of this evening, were that they expect the case numbers to rise to up to 10,000 patients in Africa per month in the next few months. So we will contain it, but it's going to take a lot of hard work. And I certainly expect that we'll see more cases in the United States before we're said and done with this.
More cases, okay. Yes, so learning about this condition and infection is the best way to prevent the spread of infection.
Yeah.
All right. Thank you so very much, Dr. Jeff Hatcher, for a very excellent information for our viewers on Ebola virus infection.
Thank you.